and oh, there we go. We're being recorded. And he's responsible for the management and administration of the 10-bed hospital there. He trains local and international students and volunteers in healthcare education and intercultural activities. And since 2018, Dr. Mendez's clinic is at the Hospital of San Pedro, and has been a clinical site for the University of Kansas Medical Center International Outreach, or our KUMCIO's first and second year medical students. So with that, Dr. Mendez, I will give it to you.
Okay, thank you. We want to start explaining a little bit about traditional medicine in Guatemala. With me, it's Lucy. Lucy is a midwife working here in the community with at least 25 more traditional beer attending in the community. And she's helping in this hospital in the last 3 years, trying to provide education and helping to provide medical care with a team in the hospital. Traditional medicine in Guatemala is it's probably the most close health system for the communities in the rural area. How we can just pass the, there we go. Can we go to the next slide? There we go. So this slide I try to show to mostly of our students, because sometimes when you have the experience working with a traditional healer, it's difficult to understand. But we try to encourage students to show respect to traditions and beliefs, and then starting with this respect, so it's better to understand, because sometimes traditional medicine, especially when you are working in the rural area, it's not something that you can just learn in Google, or you learn in a university. It's something that you have to live and have your personal experience in the environment where people work with traditional medicine. Next, please. According to the World Health Organization, the traditional medicine refers to knowledge, skills, and practice. But this definition, this concept for the World Health Organization, it's show the experience around the world, how traditional medicine and it's used not just to give treatment to patients, but also for prevention of mostly of the diseases, especially in the rural area, and include also mental health. Traditional healers in Guatemala probably are accepted for at least 80% of the population in the rural area. 80% of the population, before to visit a physician, usually visit a traditional healer. And, and one of the things that I really like about the definition of traditional medicine is like when you talk with a shaman, they they are always talking about the balance between the environment where you are living and your mental health and your health in general. So in in general, traditional medicine, it's the balance between how you feel, what you eat, how you sleep, and how you um, uh, live between others in a community. So it's a more complex definition than the definition of the World Health Organization. The health system, the traditional medicine in Guatemala, or the health system in Guatemala, it's basically split in two different areas. The Western medicine, what we know, I mean, hospital. We have two main hospitals here in the city, in the main city, in the capital, Guatemala City. And after that, we have regional hospitals, local hospitals, and health posts, uh, and the traditional medicine. And we have at least four different group of healers, including herbalists, traditional beer attending or midwife, bone healer, and shaman or a Mayan priest. Depends on which area are you uh, living. They call sacerdote Maya or shaman. And that this is basically the four areas of the traditional medicine in Guatemala. Uh, we have with us Lucy, and she it's going to explain about what she's doing here in this hospital. And after she explained, and when we finish the presentation, um, if you want to do a question, do you want to ask a question or do a comment? So we will have the time when we finish with the presentation. So in the next slide, we have a picture where I want to give the chance to Lucy to explain about this picture. Lucy, ¿podría explicar acerca de un poquito más? Y explicar acerca de. I understand that we have somebody in the group that can help to translate from Spanish to English according to Lucy's explanation about this picture. ¿Podría explicar, Lucy,
That would be me.
qué es lo que miramos ahí en esta fotografía?
Lo que estamos viendo ahorita es una mujer embarazada.
What we're looking in this picture is, what we're seeing is a pregnant woman.
Está en sus momentos de contracciones de parto.
She's in the middle of several intrauterine contractions.
Y lo que estamos haciendo nosotros es ayudar a la señora, la embarazada, que ella pueda dar a luz a su hijo.
And so what we're basically doing here is helping this pregnant patient with the birthing process.
Y la costumbre de las comadronas siempre le dice a la mujer si ella quiere acostarse en la cama o quiere estar en cuclillas o como sentada también.
And it's our tradition to ask the woman giving birth if she would prefer to lie in a bed or in that position that you see in the picture.
This part is very important, and I think uh, it's important to explain that the midwife in Guatemala are covering at least 80% of the deliveries in the communities in the rural area, and sometimes people or pregnant women don't feel comfortable to go to a hospital because usually in a hospital, women have to, I mean, doctors have to follow some protocols how to deliver a baby, and usually here in Guatemala, uh, the doctors don't give a lot of chance to a pregnant woman to decide to take the decision how to deliver a baby. But people in this community, they like to come to our hospital because we ask them how they feel, uh, what's their opinion. We just follow their advice, midwife advice and patients advice, according how they feel, if they feel comfortable to have their baby in a bed or in the floor. So, and of, we have uh, the the expression, I don't remember now, but medicina basada en evidencia, like
Evidence-based medicine.
evidence-based medicine. It's showing to us then there is not a big difference between having, I mean, medical benefits to have the baby in a bed or in the floor. Actually, probably it's more physically, it's more convenient for the baby and women to deliver a baby in the floor, but it's optional, so we don't push for the, sorry for that, we don't push women to have babies in a bed, and we see that they feel more comfortable having the baby in the floor. Okay.
Queremos ayudar a la mujer cómo dar a luz a su hijo para no sufrir mucho. Entonces, en este momento que la fotografía está en cuclillas.
So our goal is to help the woman give birth with as little pain or difficulty as possible.
No han permitir, ¿en qué forma? Y el hospital aquí del doctor Francisco Méndez, él ha ayudado a muchas mujeres y a las comadronas, porque él da pues libertad a la mujer que ella quiere tener a su bebé.
And at Dr. Mendez's hospital, the reason why many patients like to give birth here is because he gives them the liberty to choose how they want to deliver their children.
Porque en otros hospitales, en otras clínicas, no se permite que la comadrona puede hacer algo con su paciente, sino que tiene que ser lo que dice el médico en otras clínicas o hospitales, pero aquí con él sí acepta lo que es la comadrona.
This is in contrast to many other hospitals and clinics where women aren't necessarily given a choice. They must do whatever the doctor dictates is the appropriate method.
Y gracias a Dios que hay muchas mujeres que han tenido a sus bebés y han salido bien aquí en el hospital.
And thanks be to God that many women have successfully delivered babies at Dr. Mendez's hospital.
Dr. Mendez, may I ask a question?
Yes, sir.
Who is the woman who has gray hair?
Oh, que está preguntando quién es la señora que tiene cabello.
Es una comadrona también.
It's a midwife helping in the hospital also. So we hire Lucy to work with us 24 hours a day. So she's helping in different ways. But others midwife in the community are working by their own. But when they have any complication, they just come here to the hospital, and we let them to work with the team. Sometimes we know that we need more resource to keep training midwives, because one of the things that if you can see in the picture, Lucy has gloves, but the midwife, the other midwife with the gray hair, she don't have gloves. It's one of the challenge for us, because mostly of the traditional birth attending in the community, they have some like practice or behavior that sometimes can put in risk the safety of the patient, and probably it's the reason also that the second reason to have any complication in the delivery, it's infection, because sometimes the environment in at home, it's not very clean. So, and this is another goal for us, try to keep the confidence of the midwives to come here to our hospital, because it's cleanest, and we encourage her to use gloves. Estoy explicando de que algunas prácticas que hacen las comadronas que todavía es un reto para nosotros, que no les gusta usar guantes. Entonces, estamos tratando de cambiar eso. Mm-hmm. So we are trying to change that. So we know, as I mean, happens also with the Western medicine, we have some bad experiences and good experiences. So we have some activities in the traditional medicine, then it's sometimes put in risk of in the health of our patients. But we are trying to change that behavior, but it's not easy. I mean, considering that we have a very limited resources to keep training our own personnel, and also midwives. So it's a challenge to change that kind of behavior in some people providing healthcare in traditional medicine. It's happened also with like the traditional healer working with bones, with broken bones. We have a lot of experience, and sometimes they try to give massage to massage. A broken, yes, massage to a broken bone, and sometimes it get any we can see any other complication, so they bring their patient too late. So that's the reason that I mean, it's still a challenge for us, try to change some risky behavior for traditional healers. ¿Alguna otra cosa que quiera agregar?
Pues tal vez ellos también no usan guantes porque no tienen posibilidad de comprar.
Oh, that's a good point. So Lucy say then probably when she work in the community also, So usually the work of a midwife in a community, it's a volunteer work. And she said that sometimes midwives also, they don't have the resource to buy gloves or to buy any medical supplies. I mean, to keep clean the the process of delivering a baby.
No sé cómo miran ellos la tradición de San Pedro o aquí en Guatemala, lo que hace la comadrona.
She's asking about if you, I mean, the students part in this group have been familiar with the traditions in Guatemala.
So we have a lot of students here who came last year for our trip to Guatemala for a week.
Algunos de los estudiantes que están ahí vinieron el año pasado, conocieron. Yeah. ¿Puede explicarles un poquito más de, digamos, cómo es el proceso del, por ejemplo, control prenatal? Pues, ellos van a su casa o usted llega a sus casas, más o menos.
El control prenatal que da la comadrona es primera vez los pacientes o la señora llega a buscar la comadrona.
So, basically, ¿puede repetir, por favor?
La comadrona y su paciente, primero la señora llega con la comadrona por primera vez porque tiene que ir a avisar a la comadrona que ella ya está embarazada y explicarle todo. Entonces la señora llega con la comadrona y después al mes la comadrona tiene que ir a ver a la señora en su casa.
Cada mes?
Cada mes.
Yes. So when a woman first gets pregnant, she has to like kind of set up an appointment with a midwife that she selects. And it's like a doctor-patient relationship where once she has selected her midwife, they meet once a month to kind of discuss the process.
Y lo que hace la comadrona es ayudar a la mujer que está embarazada, dar consejos que tiene que comer las cosas sanas y tiene que, si es su primer embarazo, la comadrona recomienda de que tiene que tener sus vacunas.
And so at each meeting, the midwife counsels the patient on things related to diet and prenatal care. And if this is the woman's first pregnancy, the midwife will also suggest that she get up to date on all her vaccinations.
Y cada mes ir a la casa, pero la comadrona no le están pagando por mes, no está ganando nada en visitar a los pacientes en casa.
And so this kind of answers Kim's question about who pays the midwife. Nobody pays the midwife. This is a 100% volunteer job, and the midwife personally makes the visit to the woman's house once a month for these appointments.
Por eso algunas o a veces la comadrona no tiene posibilidad de comprar sus cosas que utiliza, lo que puede tener así en estéril todo, sino que busca las cosas que estén limpio, recomendar que la ropa que esté bien limpio porque no tenemos más posibilidad de comprar las cosas como guantes, lo que más se utiliza ahí.
This kind of goes back to what we said previously. That's why many times the midwives can't afford sterile equipment such as gloves. And so they do their best to just recommend that the woman's house be clean and that all the clothes that she's wearing are cleaned routinely.
It looks like Kimberly have also a question about if the community, the midwife have respect in the community. Una de las participantes está preguntando si tal vez, digamos, no trabajan de voluntarios, pero las comadronas son muy respetadas en la comunidad. Sí, son muy respetadas.
Trabajan voluntariamente, pero son, no sé, respetados por la comunidad.
That they're widely respected in the community, even if it is volunteer work. Also another, oh, I was gonna say, there's also another question about how do they train to be midwives?
¿Cómo reciben capacitación o quién capacita a las comunidades?
El centro de salud a veces capacitan a las comadronas.
There's a health center that will help train midwives.
Y de vez en cuando el centro, a veces hay una organización que a veces manda o dona algunas, así como guantes, pero solo unos pares, no más, no mucho.
And the health center also sometimes distributes the supplies that are hard to come by to the midwives, such as the gloves.
Pero no todas las veces, sino que tal vez una vez al año.
But not very frequently, sometimes once a year. And it'll just be a few pairs.
Por ejemplo, ¿usted la han capacitado ahí en el centro de salud?
Sí, hay capacitaciones, dan, o sea, más atrás, años, pues.
¿Cuántas veces al año más o menos?
Hubo un tiempo que cada mes, y después, cada 2 meses después, y ahorita con esto ya no. Y el año pasado más o menos hubo capacitaciones, tal vez a cada 2 meses.
¿Y cuánto tiempo dura la capacitación?
Media hora, 1 hora. Es lo que.
Yeah, I mean, it looks like depends on the resource of the Ministry of Health to provide training for midwife. Sometimes they have once a month. Sometimes they have just one training during a year, but it's not basically like something like they have to do every month. So it depends on the resource of the Ministry of Health.
Pero solo es capacitaciones, uno no le pagan.
And it's only training. They don't receive any economic benefit to get the training, or even they don't get any like supplies to keep going with their job in the community.
Are you guys going to open the Mendez School of Midwifery?
Say again, please.
So are you going to open the Dr. Mendez School for Midwifery?
Oh, that could be a very interesting project for in the future. We try to when we have midwives here in the hospital, we encourage midwives to participate in what we are doing, and just probably I want to let Lucy that about one. I think the last two patients that we have last week with some complications, and looks like it's because probably midwife doesn't have enough training to keep doing what it's the right thing during delivery. ¿Les puedo explicar la última paciente que vino como toda edematizada, manipulada y todo eso de sus genitales? Un poquito fuerte ahí.
Explico el último parto. El último parto que atendimos aquí en el hospital es complicada, porque la señora viene ya muy manipulada por la comadrona y, o sea, está muy complicada y le costó dar a luz a su bebé.
One of the last delivery that we have and coming with one of the midwives in the community arrived here with the patients very tired. She say, I can't push anymore, so I don't have energy. And then when we check all the external vagina, so was very swollen, and usually happens then when they are trying to do vaginal examination very often. So when we have those complications, we try to show midwives that it's not necessary to do vaginal examination very often. So they have to wait at least 1 hour or sometimes 2 hours between one vaginal and another, between one and another vaginal examination. So we try to show midwives here in this hospital how they should help their patients in and to prevent any complication. And usually also we also tell them that it's very important and it's the first step to decrease the number of complications, especially bleeding. So they have to recognize the signs of risk very early. So we have also a couple of weeks ago somebody that come with a placenta previa. In English, it's when the placenta it's not in the right position and it's in the cervix.
So placenta previa.
Placenta
It's
previa.
when the placenta is actually the presenting part, it comes first.
Yes, exactly. So this patient come basically in hypovolemic shock, la paciente que vino con placenta previa y shock hipovolémico. Hypovolemic shock, so was one of our worst patients in the last 2 months probably. So, but the midwife was trying to do a manual vaginal examination. And usually with those kind of patients, if you already have a previous diagnosis with the ultrasound, it's not right to do a vaginal examination, because when you do a vaginal examination, just you can just increase the bleeding. So those patients, they need a C-section as soon as possible. So we are trying to explain to midwives that it's very, very important, and they can save a lot of lives if they can recognize those symptoms or signs of risk very early. Uh, and that's a good question, Dr. Kennedy. Then probably to have like a formal uh, uh, training for midwives here in this hospital, that will decrease drastically the mortality rate, because our mortality rate is really, really high in the area. Thanks God, in the hospital we are. I mean, we don't have any. Uh, uh, I mean, our mortality rate is zero by now, thanks God. But in the area of Solola, all around the lake, just last year we have almost 20 women who passed away for complication like bleeding, infection, or hypertension. So uh, almost 20 women passed away last year for those complications. So and try provide training to midwives could be something very, I mean, important for our community. Thanks for the idea.
También el niño que resucitar.
Oh, yeah. We have also last week one uh, one of the delivery was a baby with asphyxia. Asphyxia perinatal. I have my translator here. Asphyxia.
Prenatal asphyxia? Is that what
Yes,
you're, yeah,
asphyxia, perinatal asphyxia. So it
perinatal asphyxia.
uh, was uh,
Was it
basically the Apgar score at the beginning was zero, and then it was I mean, we had to work very hard to start the CPR with the baby, and thanks God the baby is healthy now. So it's, but I mean, it's some of the complication that we are having here also. So we can see that during also this virus outbreak, coronavirus, so we increase like 100% of our procedures here, because mostly of the big hospitals are collapsed. I mean, they are not. The outpatient care are closed, and people are afraid to go to a big hospital because they are afraid then to get the virus. So our work here is increasing, but we can see then most uh, more midwives are bringing complication for us. So it's, uh, I mean, it's our increase. Our work. It's increasing, but also the complication. It's one of the reason that the midwife are sending patients for us. Any other question? In the next slide, we have something that we show to our students also. It's that the epidemiological profile of the Mayan communities in Guatemala. and probably in other countries, in other countries also, it's mal de ojo, susto, tristeza, y empacho. Those four diseases are better explained in the next slide. Mal de ojo, it's probably the best translation is the evil eye. Uh, and if we try to do a connection with this in this slide, then what mean or what are the symptoms that we see in a patient with mal de ojo? And looks like it's a kind of a viral infection. It's very, very similar. Some people, when they bring, especially young kids, um, uh, with fever, um, irritable, and not feeding well, or the symptoms that you can see in the viral infection. So they can see that it's they can say that it's mal de ojo. It's a kind of just an explanation about what mean mal de ojo. Empacho, it's a kind of indigestion, like I mean, when a person have gastrointestinal symptoms like diarrhea or a lot of gases or nausea. Susto, it's the, the post-traumatic shock. It's a kind of a psychosomatic disorder. And the last one that is very common for us here, tristeza, which it's basically depression, and also have symptoms of a psychosomatic disorder. Those four most common diseases that we see here in this hospital, it's basically treated for a different health healer in the community. So when our patients say that they have those kind of problem, we ask them to visit a health healer. I mean, that's another strategy for us, and it's helping to keep um, to keep our services, our hospital, or healthcare increasing with our clients. So I mean, we show respect for the traditional medicine. And usually we can see also the evidence that when people say that they went with the traditional healer for like evil eye, and the symptoms just start to disappear. So we try to respect about that. And I mean, probably we know that if it's a viral infection, it's I mean, probably a viral infection in 1 week or 10 days will be, all the symptoms will disappear. So we only try to see the benefits of respecting the beliefs of the population.
Does mal de ojo does that have spiritual connotations also?
¿Habrá alguna connotación de mal de ojo, del mal de ojo, con algo espiritual, o es más un problema físico?
Es un problema físico.
Probably it's just a physical symptoms, not any spiritual connection with that.
And then a question that thank you. Another question that I meant to ask was, I know that right after the baby's born, sometimes they put red, like a necklace or something red on the baby, or maybe even pierce the ears very early. What's the purpose of that?
Oh, yeah, that's a good question. El doctor pregunta qué es el propósito a veces que le pongan brazaletes rojos o algunas cosas que protegen contra el mal de ojo a los niños. ¿Qué es el propósito de eso?
El propósito de poner el collar o una cadena para que no acepte que lleguen a hacer el mal de ojo, sino que protege con el mal de ojo.
Yeah. It's basically looks like it's the prevention. It's to put like a necklace or a red bracelet. It's the prevention of mal de ojo. It's like before to have the symptoms. It's the meaning of the red color in the Mayan culture. It's a protection. The red color is kind of a protection.
Y tiene que ser el color rojo, no cualquier color.
Have to be the red color. We have another question then what kind of herbs using the midwives? ¿Qué clase de hierbas usan o plantas medicinales usan las comadronas?
Para el mal de ojo.
No, para las embarazadas o pospartos.
Partos recomiendan el té de manzanilla.
Oops, wow. That was a thunder light. ¿Cómo se llama? Manzanillas.
Is that thunder?
Yeah, that was a thunder. Sorry.
Wow.
So it's raining so hard here. So Lucy say that it's very common to use chamomile. Manzanilla, chamomile. Chamomile, ¿y para qué usan la manzanilla?
Para que no duele el estómago.
To prevent any pain. Eso es después del parto.
Después
After the delivery.
Dice ahí como coágulos, los sacan.
And also if help with the if there is some clots, coágulos.
Oh, yeah, blood clots.
Yes. So the clots, yeah, help to get out some clots.
Y los que usan, dice los abuelitos, usan un vaso de café, pero bien cargado y un poco de aguardiente. En vez de manzanilla ahora. Eso es lo que usaban antes.
So in Lucy say that in the past they use coffee also, like black coffee, and they put sometimes a little alcohol inside. ¿Y eso para qué es? Para sacar los clots. So to take out the clots also.
Thank you. We had another question in the chat. Do the mothers eat or drink anything special to increase the breast milk?
Que si toman algo las mamás después de tener bebés para incrementar la lactancia materna. Ajá.
Es el anís y también
anís.
Es una planta ishbut para la leche.
Ajá. Anís. Ishbut. We have I can't find the right translation for this herb, but we call here ishbut.
Es una planta.
Ishbut. Ishbut. No, I can't find a translation for that.
En San Juan hay.
In Ishbut, Ishbut. Also anise.
Anise, yeah, it's anise.
anise, but ishbut, it's more, I mean, we have some research in Guatemala about ishbut, and it's we have the evidence that it really help for to increase the breast milk.
Y también el chocolate, una taza de chocolate.
Also, chocolate help with the breastfeed. Ishbut.
Es para bajar la leche y le ponen espeso también a la leche.
Mhm. Yeah, it's just to increase the amount and the quality of the breastfeed, the breast milk. So, and ishbut, just to make sure.
I think someone put it in the chat that it is, and I might butcher this here, Euphorbia lancifolia.
Lancifolia?
Mhm.
Okay, probably Lancifolia. 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 Probably, yes. Lancifolia. Yeah, I can't find something like that about that, but should probably answer. Should. Yeah, looks like it's lactancia materna. Yeah, probably it's the same name in English. If you put Ishbut in Google, you can find a lot of information about that, but I can't find the right translation for Ishbut. For Ishbut.
So I
But-
just looked it up also, and the National Library of Medicine has an article about Ishbut, and it is a neglected Mayan galactagogue. So in other words, it's used to stimulate milk production.
Yes, that's right.
Y
And
otra
it does the same thing in cattle.
Okay.
So that's why they adopted it as an herbal medicine, but it's been centuries that it's been used by the Mayans. So interesting.
Yeah, it's we in Guatemala we have the evidence of the effectiveness of the Ishbut. Yeah. In the next slide, so we put the advantage and disadvantage of traditional medicine. So probably the advantage is that it's accessible. I mean, it's 80% of the population. It's the first thing to do before to visit a doctor, and obviously it's low cost. So we try with our students to have a walk in the garden just outside of the hospital, and easily you can find at least 10 herbs that you can use for your health just walking outside. So it's, I mean, you don't have to buy, it's everywhere in our community. The disadvantage is that we can see that sometimes delay the appropriate medical care for some patients when they are trying to use traditional medicine in the community. So the resource for research, I mean, it's very limited compared than if you try to do some research about benefits of other drugs like aspirin or metformin or any other thing. So for commercial purpose, so you can find resource. So it's difficult to get resource to try to show the evidence than some herbs. It really works. So that's the kind of advantage and disadvantage that we can see with the traditional medicine. Probably also some of the participants now can help us to see some other advantage or disadvantages. But basically, it's what we have.
Perfect. Thank you so much. I would like to welcome you all to put your mic off mute. If you have any questions, now's your time. Please ask away.
Ahorita es un espacio para preguntas.
Y hay otro también para la leche, que es muy típico aquí.
I don't have a question, but I just want to say hey to Dr. Mendez. It's good to see you.
Hello. Hi.
Thanks for doing this.
Creo que tengo foto en mi celular.
Yeah, Lucy, I'll just second that, Lucy and Dr. Mendez. Thank you so much, you guys. You're amazing, holding down the whole city. So hats off to you, and thank you for sharing this information. I think it puts a lot of things in perspective.
Thanks to you for give us the opportunity to share what we are doing here. Thank you.
We have several people greeting you in the chat. Several people thanking you.
Thank
Any
you.
questions?
Las personas escriben gracias.
De nada.
You are welcome.
Any other questions? Any final questions, final thoughts? No?
When does Dr. Mendez present again, Christy?
I have put that in the chat. Let me pull it up real quick. He will be presenting again on December 1st at 4 p.m. And he will be presenting on Mayan and I'm going to butcher this here. Dr. Mendez, if you want to help me out.
Okay.
Mayan epidemiological profile. Sorry, that's the native German speaker that's coming out right now.
Yeah, you're right. You do it. Yeah.
All right.
Yes, that's right. Yeah. Yes.
Very good. And we have many other presentations as part of our Foundations of Global Health series coming up. I've put them in the chat. I've also put in the chat the link if you want to sign up for those. And then finally, we have an assessment. So if you wouldn't mind clicking on that link and filling out that assessment, that would be very helpful for us. Kimberly, am I missing anything?
Nope, I think you did a great job. Everybody did a great job. And we look forward to seeing Dr. Mendez again.
Yeah.
Thank you,
Thank
Lucy.
you.
Thank you, everyone. And thank you, Carlos. That was most wonderful. Thank you for agreeing to help us today. You're awesome.
Oh, thank you. Hope I didn't butcher too many things.
No, you were. I wouldn't know. So I'm sure you did fantastic.
Did great, Carlos.
Thank you.
Kala, thank you too.
Happy
Thank
to
you.
help.
Thanks for the translation.
No problem. My pleasure. Thank you.
Ujú.
También él ha venido aquí.
Sí, ¿verdad?
Sí.